In this video, we will discuss workplace ergonomic basics that apply to virtually any workplace. Ergonomics, also known as human engineering, is the practice of designing machines, products, and places to better accommodate people. The principles of ergonomics are geared towards adapting the design and engineering of products and workplaces to people's sizes and shapes, physical strengths and limitations, biological needs, ability to handle information and make decisions, as well as their capacities for dealing with such psychological factors as isolation and stress. The primary purpose of the applied science of ergonomics is to study the economic impact of work, exercise, and movement. Okay, that was a mouthful. Simply put, ergonomics is fitting the workplace to the worker rather than the other way around. There are certain aspects of tasks that can increase the risk of fatigue, musculoskeletal disorder symptoms, and injuries. These risk factors can be found in a variety of tasks that an employee is required to carry out and can be divided into two categories: physical factors and environmental factors. Physical factors are fundamentally the interactions between the work area and the worker, and include physical risk factors that can lead to ergonomic injuries include all of these conditions: vibration, repetitive motion, forceful exertion. Postures to avoid: prolonged or repetitive flexion or extension of the wrist, prolonged or repetitive bending of the wrist, prolonged standing or sitting without shifting your position, suspending an outstretched arm for extended periods of time, any unnatural posture that is held repeatedly or for prolonged time. Motions to avoid: repeated motion without periods of rest, repeated motion with little or no variation, repeated motions done with great force, resting or compressing a body part on or against a surface, lifting heavy objects far away from the body, frequent reaching or working above shoulder height. Forceful exertions: the amount of muscular effort required to perform a task is called force. It is obvious that exerting more force than a body can sustain may cause severe damage to muscles and ligaments. The amount of force required for tools or machinery depends upon various factors such as load weight, shape, bulkiness, grip, and the amount of pressure required to accelerate or decelerate the load. The degree of risk generally increases with increasing force. Various parts of the body can be affected due to high force, including shoulders, neck, lower back, forearm, wrist, and hands. The risk of injury due to forceful exertions increase if other factors such as awkward posture, repetitive tasks, and extended duration are also present. The following types of employee behavior may indicate the presence of ergonomics-related problems: employees shaking arms or rolling shoulders due to discomfort, employees voluntarily modifying workstations and equipment to increase comfort, employees bringing in ergonomic products to the worksite, such as a wrist brace. Workers in non-office workplaces who work at tables or check out counters in a retail store that are set to a fixed standard height are at a greater risk for suffering injuries. Using ergonomically incorrect work tables or counters may cause injury to an employee's shoulder and back muscles. Tables and counters can be raised and lowered according to the employee's body size and position, can reduce bending, reaching, and awkward postures. Installing proper lighting systems in the workplace, including all storage facilities. Adequate lighting can help reduce eye strains, produce fewer headaches, and improve muscle strains by increasing visibility. Things to remember: 1. Ergonomics is fitting your work environment to you. 2. Physical risk factors that can lead to ergonomic injuries include vibration, repetitive motion, and forceful exertion. 3. Be mindful of your posture and to breaks to stretch and realign yourself. Keeping these things in mind will help you with being more efficient, more productive, and healthier. For more information about workplace ergonomics, be sure to ask a supervisor.